You're welcome to this presentation on racism, everyday racism, associated factors and health-related outcome by Dr. Francisca Omorodion and I, Egbe Etowa. Background information. In Ontario, self-identified African, Caribbean, and Black population accounted for 25% of HIV cases, despite representing about 5% of the entire population. Heterosexual contact accounted for nearly 48.6% of new HIV cases in Canada, making our focus on ACB heterosexual men a key in this study. This disproportionate representation of ACB population in HIV cases has been attributed to cultural norms, masculinity, racial discrimination, which is our focus in this study, and structural inequalities. Although there is copious literature on the impact of everyday racism on the physical and mental health of Black population, little comparative analysis on the impact of racial discrimination and HIV risk among ACB heterosexual men exists in Ontario. Therefore, in this presentation, we focus on identifying the associated factors of everyday racism experienced by heterosexual ACB men in Ottawa and Windsor, Ontario. We'll also examine the health-related outcomes of everyday racism among heterosexual ACB men in these two cities. What we did, we used part of the quantitative data of a larger study, the We Speak program, entitled Reducing HIV Vulnerabilities and Promoting Resilience Among Self-Identified Heterosexual ACB Men in Ontario. We adopted a measure of everyday racism, which comprised of being treated with less courtesy, receiving poorer services, people acting as if you are not smart, people acting as if they are afraid of you, being treated, being threatened or harassed. While measures of health-related outcomes included difficulty accessing healthcare, utilization of healthcare, self-rated quality of health, HIV exposure, and HIV testing behavior. Preceding the preliminary statistics, we use Poisson regression analysis to determine the predictors of everyday racism among the ACB men. We also applied bivariate Spearman rank correlation analysis to estimate the health-related outcomes of everyday racism. Now, looking at our descriptive statistics, we noticed that 64.1% of the men in Windsor reported experiencing racism, whereas in Ottawa, 54.29% reported experiencing racism. If we look critically at the number of types of racism experienced, we noted that majority of the persons who reported racism experienced more than one type of racism. Then looking at the types of racism experienced critically, we saw that in Windsor, the majority of the persons who experience racism experience the fact that people acted as if they are afraid of them. 49.4% reported that experience. In Ottawa, the majority of those who experience racism said they experience it in the form of being treated with less courtesy than other people. At least 43.3% reported that. Then second largest to that in Windsor is being treated with less courtesy than other people as well. 48.1% reported that. Then in Ottawa, the second highest form of racism experienced is people acted as if they are afraid of you, in which 41.4% reported experiencing that. Now, looking at the predictors of everyday racism, we did separate analysis for Windsor and Ottawa, and we found that in Windsor, age, employment status, income, sexism, and traditional masculinity correlated positively with racism, implying that older men in Windsor were more likely to experience racism. Those who were employed also were more likely to experience racism than those who were not employed. Men who reported income were more likely to experience racism than those who were not did not report income. Also, men who experience racism, sexism, also experience racism. Then in Ottawa, we found that country of birth, employment status, income, fluency in language, and sexism had positive correlation with racism, implying that people who were born in Canada were more likely to experience racism. Men who were employed were more likely to experience racism than those who were not employed. Those who reported income were also more likely to experience racism than those who did not report income. Then those who experienced sexism, just like in Windsor, also experience racism. Now we looking at the outcomes of racism. We use bivariate analysis, and we studied 5 health-related outcomes of racism, and we found that 2 of these had significant correlation with racism. The first being difficulty accessing healthcare. The results show that men who experience racism, had difficulty accessing healthcare. Also, men who experience racism also reported lower self-quality of health. In conclusion, we stated that most ACB heterosexual men, irrespective of their socioeconomic status and length of stay in Canada, experience anti-Black racism. Such experiences of racism affect access to healthcare and is negatively correlated with self-rated quality of health among ACB heterosexual men. Therefore, we recommend that HIV prevention strategy must adopt a holistic approach that includes targeting anti-Black racism in workplaces and in the healthcare system. These are our references. We hereby acknowledge the support of CIHR and the Ontario HIV Treatment Network, who funded the We Speak program from which these analyses came out. Thank you.